Hi, everyone. I see a lot of familiar faces. I promise this was not just Canadians joining the call. We had a number of people respond, and I see that some of them are joining us now. I'm going to share my screen, so give me a second here. And there we are. How does that look for you all? Is that good? Can you see it now? Yes? Perfect. All right. So thank you for joining us today. Lisa and I are going to take turns presenting on two projects. The overall title today is Inclusive Early Learning and Accessible Childcare. And we're going to share two projects that we've been working on. Um, See, there we go. All right, so the first is the Gender Inclusive Early Learning Project. It was a short project we did last year, and my colleague Jade Groom-Pike is on the call. She was the research assistant who worked with us on that program. And the second one will be our Equitable Start program. And it is the program that I've referred to in the past about the licensed childcare in women's shelters project, and it's new. Jade also works as a research assistant for us on that project, and Lisa Lalonde is our project coordinator, so she will be sharing that part of the project. Before I start, most of you know me, but just super high level. You heard my bio, so I won't bore you to death, but I'm currently a full-time professor in the Bachelor of Early Learning and Community Development program, and I'm very passionate about inclusivity and social justice and ensuring that basic needs are met and that access um, is equitable. Lisa?
For a second there, I thought you wanted me to tell me about more about you. I'm like, I have other things to share about Leigh, but maybe we'll go back. We'll just go with you. We'll go forward. Hi, I'm Lisa. As I was introduced, I'm a registered ECE here in Canada. I am the coordinator and a professor in the Bachelor of Early Learning Community Development alongside Leigh. And what I'm excited about this opportunity is in the bachelor's degree, it's always been making this connection about how early childhood educators in our context are community developers as well, and making those bridges in spaces we haven't seen. And so the Equitable Start project and the project that Leigh's talking about is something that I think is very cutting edge for us and also very progressive in that pursuit of equity for children and equality.
So the first project I'm going to talk about was our gender inclusive early learning project. And I will dive into the project, its scope, its methodology, its outcomes, and all of the deliverables. But before I can start, I wanted to share just a little bit about why gender inclusive early learning is so important. So, a little bit about me and my family. I'm married, and my spouse's name is Chris. Chris identifies as non-binary and uses the pronouns they, them. We have one child, Marlo. We adopted Marlo the day she was born, and Marlo is Indigenous. We work very closely with our Indigenous community to ensure that we balance and help her connect to her roots, and we learn alongside her as we do that. Um, as a parent, uh, it has been difficult navigating the various social systems and just community in general. We watched a number of people stumble over how to address our family, try to understand who's who, people stumbling over salutations, stumbling over pronouns, really reinforcing gender stereotypes, assigning gender binary labels. We would get questions like, where is she from? Who's the real mom? And some of the more frustrating things from a pedagogical perspective as well as a human perspective is being asked questions like, well, if there's two moms, we have budget for one present for Mother's Day. So who do we make the Mother's Day present for? And who's more like the dad? And it was frustrating. And it didn't come out of a place of malice necessarily. A lot of it was the people we were working with in the early learning settings, the people we were working with in the community environments didn't know where to start. They felt uncomfortable. They didn't know how to open the questions. And it seemed like no matter what they asked, it was the wrong question. Um, so here we are. As a mom, as a advocate in the community, I wanted to use our experience as an opportunity to learn and grow because we're certainly not the only gay family with an adoptive child who's a different race or ethnicity than their parents are. And although our experience was very important to us, it wasn't a unique experience. There were other families like us. And when we looked at things from a systems perspective, in Canada, in Ontario, uh, early learning and childcare early childhood education is really committed to making early learning more inclusive. And we have a governing body, which is the College of ECEs, and they have guidelines and practices to help ensure that early learning is more inclusive. So in 2020, they produced this document called Practical Guidelines for Diversity and Culture. So we wanted to use this as a starting point to see what are they saying about inclusive early learning? What are educators being advised on? What is the guidance? What are the resources and supports? And gender was mentioned in that document 15 times, but it was listed. And when our students and our educators and myself looked through to see what exactly was being shared, there weren't specific directives or clear examples of how to make things more gender or family inclusive. So we knew something practical was needed. At the same time, I had my personal experience. I had other parents within the queer community talking about how it was difficult navigating the system, feeling included, having people understand. But I also had a huge pool of students who did practicums and internships that would come back with experiences of how do I navigate this in practice? We have a small child who wants to be identified as a gender they weren't born into. How do we support them? Parents are asking me how to support this child who wants to be called a different name or wants to wear dresses, or students would share examples of either conflict or disagreements with other educators, with parents, or with even just opening up discussions when a child who is named Rick wants to wear a dress or carry a purse, and mom and dad don't support that and get mad at the educator, or the educators don't know how to support Rick in their play. And then at the same time, we had educators and early learning centers reaching out to us at the college or reaching out to me in the community to say, I don't know where to start. How do we make our program more inclusive? Like you talk about this in class, you talk about building inclusive communities, but with this one, we don't even know where to begin. And throughout it all, gender plays a crucial role in early learning identity formation, and it shapes how children perceive themselves and interact with the world. They need to feel supported. They need to feel a sense of belonging. They need to feel like they're included. So, with my personal experience with referring to this document, trying to see like how do we make this practical and tangible, with students coming to us, with other centers coming to us, we thought we need to do something. We wanted to take a minute to respond to this need of something practical, something tangible. And so, in a very small team, myself, Jade, one other researcher who started with us but was unable to finish the program, and one other research assistant, we thought, what is out there? It doesn't have to be Canadian, it doesn't have to be specifically about making early learning more inclusive, but what's out there about accessibility, inclusion for young people, for families? Are there any tools? Are there any tip sheets? Are there any strategies? There was a lot of different pieces, but nothing specific to early learning. Definitely nothing that we could find that spoke to the center itself. There were a lot of independent training. There was a lot of independent resources. There were courses and professional learning people could sign up for and pay, but nothing broadly accessible to all. Nothing free, nothing that was even endorsed or standardized. So we thought, well, there's got to be some of these tools that we could adapt, create, modify. There's got to be something we can build on instead of reinventing the wheel. What can we do? What can we produce to help early learning centers see where they're currently at and help them move towards being more inclusive? But pause. What does more inclusive even look like? What does it sound like? What does it feel like? Where are these examples? So we thought, well, you ready to do something really ambitious? Let's let's create one. Let's make a tool. Let's try it. Let's create a list. Let's create something tangible. So we applied for a little grant, and with the support of a program that was being operated at our college that was funded by the National Sciences and Engineering Research Council of Canada. Um, Through our applied research granting program at the college, we got a $50,000 grant. And we had 6 months to make the magic happen. So, scramble. Um, in that 6 month time, we had been discussing the idea through our college program committee and our community partners that we work with in early learning. We had an idea of what we wanted to do, and I asked for volunteers. Do we have a couple of early learning centers who would like to go on this little journey with us to figure out how to create a tool to assess how accessible we are and commit to working towards being inclusive? And we thought, well, maybe we'll do 2 or 3 centers. That would be a good number. And we had 6 sign up. And we thought, well, with only 2 research assistants and 6 months, six might be a bit much. So we narrowed it down to three. And so we had 3 community partners, and our research team developed a tool. We piloted it with the 3 centers. It was a self-assessment tool, which I'll explain in a minute. And as part of it, once we assessed where they wanted help moving along, becoming more accessible. And so one of the areas I work in is bibliotherapy, developmental bibliotherapy. So we created some tools and resources for in program. We created a training video and we shared it broadly. So I'm going to walk you through the steps. So I'm not too sure how familiar people are with GBA Plus, but it's the Gender-Based Analysis Plus program. It is what our Canadian government uses. It's an intersectional framework, and it involves taking a gender and diverse sensitive approach to service delivery. And in essence, the scale in and of itself focuses on taking things from gender unaware, which was formerly called gender blind, and it moves it along the continuum to becoming gender aware, to becoming gender informed, to then ultimately gender transformative, where all barriers to gender are removed. And this framework had been used for well over a decade in public programs and private sectors in order to receive funding from the Government of Canada when I worked in community and uh, international work. You had to comply with your programs being at least gender aware. And towards the end of working in the community, we had to be gender transformative in order to receive funding. So I liked this model. I was familiar with this model. It had never been used in early learning. This was like a new area to look at it. So with our research team, we'd combed through to see who else had used this tool. And one of the articles we found in Health Sciences literally put the continuum on this little arrow. And we thought, that's it. That's a clear visual. It shows how you progress. unaware, aware, responsive, transformative. Great. We have a continuum. So then, with this continuum, could early learning centers say where they are on it? And if you were aware, how do you get to transformative? And so we thought, well, that's a great idea, but we can't just talk about broad concepts. So we wanted to sit down and figure out what aspects of early learning do we want to assess? What happens in a typical early learning program? And through looking at the literature, we generated a list and we thought, well, language matters, literacy matters. Then there's the space, the physical space and environment, how children play, what they play in, policies, policies within the center, and policies from like a municipal or a provincial level. We wanted to look at pedagogical practices, how teaching happens. We wanted to look at family and community engagement, research, professional learning, advocacy, all these different elements of an early learning program, of an early learning center, and assess each one individually. And then we were thinking through it and we thought, well, we can ask them the questions, but if we don't have specific examples of what it could look like, how can they assess? So we created a tool and we thought, well, between Jade, Rhiannon, and I, we sat down and we just kept massaging what each level would look like, what it would sound like, what it would feel like. Um, and we thought, well, we can't just give them one tool. Well, let's do a pre-assessment and ask them without giving them all the details, where do you think you're at? Then give them the tool with all the details to assess where they're really at, and then ask them to reflect about it. So we created the tool. This is the pre-assessment tool whereby they literally saw those 10 elements and they were asked, if this is the scale, unaware, aware, responsive, and transformative, where do you think your center, not individuals, where do you think your center is in terms of the language you use? Is your language gender inclusive? Where do you think your center is in terms of pedagogy and teaching? Where do you think your center is in terms of research and knowledge sharing? And it was very high level. It frustrated them. They wanted more details. Well, what does that look like? What does that mean? And we said, bear with us, do the pre-assessment. So they all did a pre-assessment and they were worried. They were worried. Oh, I only scored 6. I only scored 4. What do you mean the maximum score is 3 times 10? It's out of 30? We said, just let it go. This is just, where do you think you are? And then we went into the full assessment. And each of those 10 areas we broke down and we gave very clear-cut examples. For example, with language, we broke down if a center was unresponsive, they would be reinforcing gender binaries like mums and dads, boys and girls. They would only offer 2 examples on their registration forms and paperwork, male, female. They would use very kind of traditional family structures, mom, dad, children. If they were gender aware, they might have a bit more understanding, but their practice wouldn't necessarily support their language. If they were responsive, they might be aware of the proper salutations, Miss, Mrs., Mr., Mix. And to even complicate things further, some of our programs are francophony, they speak French. So trying to convert salutations and verbs en français with the verb conjugations to be gender neutral was even more difficult, but it's happening. So if they were aware and trying to respond, um, they'd fit within the gender responsive. And then transformational, to be gender transformational in their language, they would have inclusive. They would not have any predetermined fields. There would be more blanks for people to self-identify. They would be asking questions about relationships, titles, pronouns, etc. And so for each of those 10 elements, there was a rubric like this where they could then assess where they truly are as a collective, as a center. At the end of them going through all 10, We then had them reflect on it. We asked them to think about, how did you score in relation to what you thought you would score? We asked them to think about priority areas. Now that you've seen how you score, is there any work you want to do? Is there an area we can help you move along that continuum? And we asked them too to comment on what are they going to do moving forward to be more inclusive. And so we asked them to write down commitments to change. So we had three centers who volunteered. They piloted, they did the pre-assessment, the actual self-assessment, the reflection, and we said, where do you want help? Where do you want to change? And most of them talked about moving forward, they would make the commitment to talk about gender inclusivity and family inclusivity on a regular basis, whether they were incorporating it into their meeting agendas, their team agendas. They wanted to have more materials in the center that represented gender diversity and family diversity. They wanted their whole staff team to take the GBA Plus training, which is free. It's a resource that the Government of Canada provides for free. They wanted to create space and opportunity for more information for the educators, for the children and families, and also resources for the families to take home. If we looked at it from a systems perspective or like a how we see the child and how it operates, a Bronfenbrenner model, systems model, they knew that they couldn't just be doing something as staff, that they wanted to do something that could be shared with the family and community at large. They wanted to engage in more professional learning and they wanted a way to check their own personal bias. Um, so, in addition to getting their commitments, we also asked them for feedback on our tool. So, we asked them what worked, what didn't, what parts of the tool were intuitive, what do we need to give clearer instructions on. Generally, they liked the tool. We thought we had brainstormed forever on the possible scenarios of what it could look like, but they still said that they needed more examples. So we went from having one or two examples on our tool to a lot. And we thought that would be information overload, but they liked it. And then they also said, well, Leigh, now that we've assessed ourselves and you've asked us to reflect on it, can your team create like a checklist for us? And we had thought it was intuitive that if you scored gender aware on something, just look two boxes over to gender transformative and then do that. But they were like, no, that's too much. Could you just make us a checklist of how to become a gold star standard? And we were like, well, the fact that you're even talking about it and willing to reflect already makes you a gold star standard. And they said, no, 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 we need a list. So we took all of those columns and we created a checklist of all the things to do in the 10 areas so that your center could be gender inclusive and that gold star standard. And as part of their responses and commitments, they wanted to make their environments more inclusive. They wanted to make um, their environments, what the children play, what they read, how they interact, their signage, everything more inclusive. So we created a training video, which I'll get to in a minute. However, the other thing we did was we created a bibliotherapy catalog and a compendium. And for those of you who don't know what bibliotherapy is, um, high level, it's the use of books and literature to work through and help support mental health and emotional well-being. So it can be done in a clinical practice or it can be done from an educational practice. So the work I do is called developmental bibliotherapy. And developmental bibliotherapy helps people process emotions, personal growth, and it helps them develop coping strategies. So that's kind of the high level overview of bibliotherapy. But when we look at it from a child perspective, children can benefit from bibliotherapy because they learn how to identify. They learn how to understand and articulate ideas, concepts, difference. They're able to develop empathy and compassion. They have exposure. They're able to improve their problem solving skills, resilience, and they learn how to learn about themselves and their identity formation. And during a developmental bibliotherapy experience, it's not just the child that would be benefiting. The educators who are using the books and having the conversations with them also develop and benefit. The adults reading the books, the parents, the families reading the books also have an opportunity to grow. It develops a deeper understanding of what the child is experiencing. It helps them unpack their biases. It helps them formulate language, big concepts. It helps them problem solve, et cetera, et cetera. So, what we wanted to do was when we're talking about gender inclusive early learning and family inclusion, we wanted to curate a list. So, Dr. Shoshana Magnet and I had started the project way back at the beginning conversations, and she had a small list on her website. I had a list that I had been teaching and using, and we wanted to put those lists together. When Jade and Rhiannon joined the team, Jade had the responsibility of also helping seek out any additional books. I think at one point we had like 100 and some odd books on our list, and we pared it down. We got down to about 64 titles. And then we thought, well, why are each of these on here? Why are they so important? And we started to go through and group and categorize those books. And we grouped them into 5 different sections. We had a group about gender identity, intersectionality, big feelings, creative expression and persistence, and self-love. And we thought those kind of 5 areas were an area to start. But then the question came with, well, it's a book. We don't want to just sit in a circle and read a book. We want to make it so that there's an opportunity to interact, that those books are out for people to see and read. But then there's also some tips and strategies for educators on how to use the books from a developmental bibliotherapy practice. So we created a compendium, and it was literally a Word document with a copy of the book, and we curated a description of what the book is about, some of those topics it talks about. We looked at an average age or audience that the book could be used for. And then we went through some talking points, and we had some high level talking points, but we wanted to make sure that if this is the book, this is what it's about, and these were the talking points, we didn't want to then go back and tell educators how to do their job. We didn't want it to be prescriptive. We wanted to check in. So luckily, we have a team of educators on staff at Algonquin, and we checked in with our faculty and had them critique the books, the description, what it's talking about, and come up with some of those talking points for the educators to be able to work with. And we vetted this tool, and we thought, well, let's buy a copy of each of the books for each of the centers we partnered with. So we bought all 64 books for all 3 centers and provided them with a copy of the tool. And the centers received the books, and they all kind of did something different with them. Some of them put it in a lending library, some with a catalog shared for families so they could take the books out and talk about them at home. Some were left in the common areas, some were distributed to rooms. Some were taken out for different themes. They all handled it differently. They were very appreciative of the books, and they've now added to the collection. They keep adding more and using them quite a bit. So that was the bibliotherapy part. And then we kept getting asked questions about, like, what else can we do? Can you show us? Can you talk to us about what gender inclusive pedagogy and teaching looks like? What's gender inclusive? What's gender transformative research and knowledge sharing? Like, how do we do this? So we created a training video, and we wanted to make sure that that knowledge transfer piece included components of the theory with practice and finding it so that we could use it as an education opportunity. But we also wanted to figure out the way that we could get all of our tools and resources out for free so that nobody had to pay and that they could be utilized however best. Um, so part of the video talked about like the theory. It had the tool. We walked them through what the tool was and how to use it. The bibliotherapy compendium, how to use it, and in the video, I believe it is Rhiannon goes through two or three book examples of how to use it and what to ask with the children. We shared that checklist of how to be gender transformative, and we broke down each of those 10 areas with examples of best practice. That training video was made available, and we also made sure that there were QR codes to additional free training that they could access for their professional learning. Because we didn't want to claim to be the experts in this area, and we knew there was a lot of other really cool stuff that we had either built on, shared as a resource, or would endorse. And we included that in the video. Here's just an example of some of the concepts that we talked about in the video. We gave examples, we gave visuals, we shared how to talk about really high level, difficult, complex concepts with 2 and 3 year olds. How to talk about, you know, the genderbread person when we're talking about the difference between gender identity, gender expression, attraction. We wanted to include very simple examples of language and how to introduce yourself, how to ask who the various adults in a child's life are without making them feel like they don't belong or that it's hard. Um, and it was more than just pronouns, it was asking the children for the language they use. We had been asked so many times, like, wait, you got two moms, and Marla would explain, yes, but my mama Chris is non-binary, so they're my other parent. Oh, you have another parent in this situation? No, I have my mommy and my mama, but my mommy Leigh is my mom, and my mama Chris is my parent. And they were like, oh, okay, well, your moms are here. And it wasn't because they didn't care, but they didn't understand the language. Well, it doesn't hurt or help the matter that Chris and I look very similar. Same height, same, dark hair, short hair, big glasses whenever we're out and about. But we still had experienced it, and we'd watched Marlo have to explain it over and over again. And we watched Marlo getting frustrated that, well, how can they understand what mom and dad mean in several different languages, but they can't grasp the concept of two parents, one female, one non-binary. Um, so we wanted to try and include examples. And one of the centers that we worked with had beautiful acknowledgments all over their space about it being welcoming space, about them having not just land acknowledgments, but also statements of non-bias and statements of what inclusivity meant. So we shared examples from that center in the video as well, that they weren't just all abstract from the internet, that we also tried to share best practices that our partners were currently implementing. And so at the end of the project, we really wanted to focus on one, finding a practical solution to helping early learning centers and educators create gender inclusive environments, gender inclusive space. We wanted everything to be accessible and free. We didn't want educators to have to pay for more professional learning, and we wanted something more at a systems level. We shared all of our work and resources with the College of ECEs. We wanted to figure out a way that educators could make use of it. And again, it's a draft. If it was things to add, to edit, if people wanted to modify the tool, it was a starting point. It was a starting point. It was a starting checklist. It was a starting best practices to open the conversation. We've also incorporated it, much of the work on gender inclusive early learning into our degree program courses. We have purchased books for our library for our students, And one of the partners was our lab school on campus. Our early learning center was one of our three partners. And so we really wanted to, make it accessible. We knew at the end of the day that early childhood educators and centers weren't trying to be exclusionary. It was that they didn't know where to start. Something practical was needed. And by completing the work that we did, we offered something that was practical and available. So I'll pause there and I will pass it over to Lisa.
I'm like, there's so much there. The so much in that. And having observed it from the outside and watching it, when Leigh talks about the transformation of the agencies, which many of them I knew professionally, and as Leigh acknowledged, people are doing the best they can with what they have. But what the acknowledgement of this project was there wasn't enough for them. So they needed more, and there was an appetite for more, which was really exciting. And watching it in our curriculum unfold has been quite amazing. What I'm excited to be able to share, and is very brief what I have to share compared to the depth of what Leigh had to share, is the next project that Leigh and I, and alongside with Jade, are working on right now. And so we're working with a project that's called Equitable Start. And so the idea is accessing early learning and childcare for survivors of gender-based violence. If you can go to the next slide, Leigh. So we're coming from a Canadian context, and we have looked. We've done a cursory review internationally of trying to find something similar to this. So at any point, if there's examples that fit, we are open to making those connections. So please, at the end, let us know. But one of the pieces that really sat with us is that we know that gender-based violence is a significant issue internationally. We're no different here in Canada. Um, when a mother is fleeing a home of domestic violence, taking her young children with her in Canada, they will go to a local women's shelter, which are often they're community-based settings, but they're more home-based settings. Especially in Ontario, across the different territories and provinces, things will look a little differently. Traditionally, when that mother leaves her home and then with her child and goes to a shelter, the time that they stay in there used to be a series of weeks, maybe, 6 to 8 weeks, maybe a month or two. In 2025, on average, it's between 7 months and a year. So it's a significant amount of time because of the housing issues that we have across Canada, where women aren't able to access more stable homes or stable housing. And so traditionally, when this mother is not only leaving these circumstances, there's a lot of trauma, there's a lot of unknown. And traditionally, what has happened is the child will be with them. In the program, there is staff that would support watching the children for a few hours. But because of licensing requirements, they couldn't be there more than that. Which would mean that this parent would have to take their child with them to their appointments. They were talking to the police, if they were going to doctor's appointments, if they were trying to get jobs, everything that they were doing, banks, like the list goes on and on. And so the child would have to go alongside a lot of those appointments. And something about that kind of shifted as Canada was starting to embrace this idea of having equitable and equal access to early learning across the country. So, as I'm sure many of you know, the United Nations Convention of the Rights of the Child states that children have the right to be safe from violence and to have equal access to high quality early childhood or education and care. And the government of Canada in 2021 dedicated $30 billion dollars over 5 years. Last year, with the new government, they also have made a further commitment to continuing on this idea, and that's the Canadian-wide Early Learning and Childcare Act. And so across the country, the goal is to have families have access to $10 a day childcare. Now, for full disclosure, in Canada, we are not down to $10 a day across every province. We do have a complex country. By geography, we're really large, and there's a lot of people spread out in a very large space. So we have very dense urban areas, and then also very, very sparse rural areas, including also our northern communities and territories where things are not one size fits all, which is a great way to do things, in my opinion. With CWELC, which is the terminology we use, one of the challenges is that how do we access that? It has to look differently in each province and territory. And so as this was rolling out, and we're seeing the estimate or the goal for the Canadian government when it was first implemented in 2021 was approximately 250,000 childcare spaces to be impacted and built around this. I believe the number is around 280, which is the goal and implementation now. What we're finding is that surprisingly, and I'm sure this would be no surprise to of colleagues across the world, is that parents need access to quality early learning. We know we have the data, the research, the evidence that every dollar invested in early years returns to communities, to countries back anywhere between the numbers will say $5 to $9. So we know there's a return on investment on this. We know that the OECD talks about the importance of this and access. And so we actually have a government currently trying to build a system. It's not perfect yet. There's still some pieces. And one of the challenges being is that when early learning becomes accessible financially, in Ontario, for example, and I'll use Ottawa numbers, Toronto were similar, a little bit higher. Infant care was approximately $100 to $120 a day. It currently in Ontario is sitting at $20 a day. So for all families, all of a sudden this becomes more accessible. More people can return to the workforce, more people can access the education differently. And this that funding isn't based on subsidy. So our subsidy model in our province at least still exists. So people who can't afford the $20 a day can still access that. But one of the gaps that ended up happening was looking at who isn't able to access this. And what we have seen historically, some of you may be familiar with the Quebec model. So I believe it was in the 90s, I can't remember, early 2000s, Quebec, our province, just to the east of Ontario, created a universal system across the province where everybody had access to, it was $5 a day. And it was deemed a great success until capacity hit. And so we're at this point now where for $10 a day, $20 a day, a lot of parents will access these spaces and maybe not use them every day. And so there's a bit of a challenge in saying, which children aren't getting access to this? How are families not finding this? And where are the places where children may need it even more than we originally estimated? Moving on to the next slide, Lee. So when the CBOC funding was being allocated in Canada, the federal funding then goes to the provinces or territories. That then in our province of Ontario, it goes to our municipality. And so in our municipality, in the city of Ottawa, we work with an amazing groundbreaking agency, the Andrew Fleck Children's Services, who had been supporting a few shelters within the city, but they were not able to license them. And a group of very, very forward-thinking individuals, and the executive director of Andrew Fleck Children's Services, Kim Hiscott, has a very visionary brain, and she was sitting there and they were having a conversation and saying, we have these shelter spaces and we have children in them, we have families in them all the time, but these parents don't have access. What can we do? And so what they began to do is looking at ways of making those shelter spaces, which we now know children are, like I said, spending between 7 months to a year minimally in those spaces. How do we ensure that they have access equally with equity and equality as well? And so, with federal funding, support from the Women and Gender Equality Canada, the project that we are talking about today was supported. And what the intention of that was to be able to document the process of Andrew Fleck getting these spaces licensed. So you'll see these are some of our partners within this with this project. So we have Algonquin College, which is Leigh and myself, Andrew Fleck Children's Services, who are the lead on the project, and they are the ones who are partnering with the shelters. The City of Ottawa, Women and Gender and Equality Canada. And so what's really neat about that is that there's all these interconnections of, community-based programs, municipal-based programs, provincial spacing on top of community-based organizations and early learning. And so in Canada, we have licensing that looks very differently in each province. It's very similar, but it's different. The idea of licensing is to ensure that idea of stability, high quality, and support for children's growth and healing. When licensed space is offered in shelters, the intention is that it offers comfort through consistency and also a chance for a child to thrive despite the adversity that they're in. So when we have licensing standards, that includes qualified early childhood educators being in those spaces, which allows the children to spend more hours a day. Now, in the shelters, the licensed space in a traditional licensed program, they could be between 7 and 8 hours a day. In our licensed shelters, it's around 5 and 5.5, depending on the site. As I was saying, across the country, in each jurisdiction, there is unique licensing and pedagogical requirements. In Ontario, we have something that's called the Childcare and Early Years Act, the CCEYA as we'll call for short, and that talks about ratio space. It's very safety oriented. There's small pieces of pedagogy in there, but we have some other documents that support that. In our licensing in Ontario, there is parts about family age grouping. So there already was pieces in place. Many of those things were added for rural communities or Indigenous-based communities so that it wasn't a one size fits all in our goal to build a bit more of a decolonized perspective of early learning. There was aspects of put at that, but we generally don't see it in urban settings. The shelters already had a dedicated space where the children had, we'll say, a playroom or a community space. And so in the licensing process, Andrew Fleck was able to work with the Ministry of Education, which is our licensing body in Ontario, to be able to make sure that all the requirements were there. Surprisingly, this was challenging, which wasn't the surprise, but also not as challenging as some may have thought. One of the biggest aspects of the challenges is that in Ontario, all licensed childcare agencies need to be listed in a public space on the web page. Obviously, women's shelters are not going to be posted in a public space. And so that was actually one of the biggest hurdles that we have heard from the Andrew Fleck team, because the ministry they couldn't see past how that could be done safely, and through deep conversations, figuring out what needed to be there and not being there. Andrew Fleck is the body that license the shelters, the childcare space within the shelter. So Andrew Fleck has a space. They have an address that they could use, and so they use that for the licensing. So therefore, the shelters themselves never have to be publicly published, which is something that was seems like a simple fix, but it actually took quite a while to get to a place of agreement on that. So what we're really excited about in our project is we were funded by the federal government. You can go to the next slide, Leigh. You're right, totally. For a 24-month project. The goal for us in our project is that we are going to be documenting this process. So the educators, the team, the leadership about who came up with this idea, how did it, what were the barriers, what were the roadblocks, what were the success points? And alongside that, we're going to be creating two toolkits for early child educators. In Ontario, you heard Leigh talk about our College of Early Childhood Educators. We are the only province in Canada that has this, but similar to a college of teachers, a college of nurses, we have a college of massage therapists, social workers, etc. In Ontario, we have one for ECEs as well. And that is great in the way that it builds a standard in our province. It's built a standard for our 2-year diplomas and our 4-year degrees that are able to offer this credential. But what it challenges sometimes is we do have to be able to stay very similar, and we have to have alignments with all the other programs across the province. One of the areas that we've already done a cursory review is that there just isn't enough trauma-informed practice being taught in our 2-year and even in our 4-year programs, and also the idea of self-care and well-being. And so I defer to a lot of our colleagues internationally in regards to social work and in child and youth care, because self-care is built into many of the curriculum spaces, and in early childhood it is not. And so it's something we know that we can't reinvent the wheel. We know that in Canada, because of a series of things, including this expansion with the National Childcare Plan, we're in a workforce crisis. So we need to be building early childhood educators with great skills, but we can't be slowing them down to get into the sector. So this project builds a really neat opportunity to bridge what we know is happening in this space. So we have these shelters that are now licensed. There is 5 of them in Ottawa, and to our best understanding and knowledge, they are the first in Canada. And even internationally, we haven't found something that's exactly the same model as we're doing. But again, anybody who has opportunity that they're able to share, we're really eager to partner in conversation. But we're really trying to build supports for not only the educators that are working in these unique settings, but also anybody who's basically working with young children and families. Post-pandemic world in the and let's be honest, in 2026 in general, trauma is around us. And so having supports for people who might not have enough of that pre-service to be able to access it in service is really, really what's guiding our next steps in the project. So as I outlined, the process, one of the big things that we're doing ongoing over the 2 years is documenting the process. And so in regards to, we're building a roadmap. Um, Leigh, did you want to talk to more about this specifically?
Sure. We have the umbrella project, but we wanted to get all of the different perspectives from all of the different people involved at all of the different stages. So we have a roadmap to document like how it came to be, some of those struggles, the different pieces of legislation. Because to the best of our knowledge, we are the first in Canada to do this. And because the systems operate differently, municipal, provincial, federal, what is aligned where, we want it to be able to share what we have so it could possibly be replicated with slight variances in different provinces. So getting the roadmap established of how we did each step was important. But then we also wanted to hear from all of the participants involved. So we're trying to get the child's experience, the parent or the mother's experience, and the educator's experience. So we currently have two active parts, two in the queue parts, and a fifth part about to jump into the queue. So we're currently doing, well, we've just closed a survey, have we not? We had a survey that we wanted to send out to educators across Canada. It was a pan-Canadian survey. We currently have just over 1,000 responses, full responses. And it was asking educators about trauma-informed practice as well as self-care. And so we're just in the beginning stages, but this was to help inform what we should put in the toolkit. Like, where are they at? What do they need help with? And we won't get into many of the findings yet, but it's surprising how many people will talk about their trauma-informed practice, but are reluctant to disclose self-care. Um, but we're going to start to analyze that data set and use it to inform the development of the toolkit. And then we also have right now, Jade is interviewing all of the people that we had from the beginning. So Kim, the executive director, the people that she worked with, a couple of us who wrote the grant with them to get things started. Lisa is the project manager. I'm the principal investigator. Jade's the researcher. But we have all these fantastic staff. We have coordinators and educators and partnerships because each of these shelters are separate entities. So some are French, some are English operations as well. So they all have unique relationships. So we're working with all of the people that were involved. How did it happen? How'd the magic happen? What have you learned? What can we improve on? And then we're going to do some focus groups with the moms to ask them, having access to this, what has it meant to you? And have those conversations to figure out what the impact of licensed childcare with located within the gender-based violence, escaping gender-based violence shelters has meant to the women. And finally, probably my favorite piece that we have starting is we're going to be asking the children through a series of drawings to explain what it's meant to be in licensed childcare in a child-friendly way, for them to be able to share what having access and being included has meant to them. Um, is it still on me or back to you?
Uh, s- Thank you. So, well, it actually goes back to you because it was in regards to looking at not only the toolkits, but going where this is where the loop and the connection goes back into and the,
Right.
yeah.
So building on the bibliotherapy work that we did in the previous project, we thought that with these centers, it might be important to be able to have a developmental bibliotherapy piece for the children and the educators, and really to help the children process the trauma they've experienced going through violence in the home and moving to a shelter. We wanted to curate a list of books that would help them process some of their feelings, experiences, and to make sense of their identity. So, unlike their gender identity, um, they are too survivors of domestic violence, just as their moms are, and wanting to help them work through and talk about that without shame. So we put together a bibliotherapy collection and a compendium for this piece as well. We took a few of the pieces from family diversity and gender diversity and borrowed those. But then we created new titles. And you can see on the screen, we talked about anxiety and those big feelings with books like The Invisible String and normalizing those big feelings like why do we cry? Talking about some of the fear and trauma that they may have experienced, like once I was very, very scared. Um, and also the big bad wolf in my house. Some days he growled. And they're child appropriate at different ages and stages, pieces of literature that help children process those big feelings and concepts and unpack what they've been through. Again, it's not a clinical practice, it's from a developmental practice, so it's just about learning. Um, and we came up with a list of 66 books, and these areas were gender and identity and intersectionality and family. But then we added with the big feelings, processing trauma, and love and identity. And we did the same thing where we had the title, the description, the age group, and some talking points. The books are available to educators, children's, and the women in the shelters. And we bought copies for all of the licensed childcare spaces. And Jade had the lovely task of finding the French equivalent because two of our centers are Francophonie. So we had to find French versions of all of the books and have all of the documents, the bibliotherapy compendium translated into French.
Yeah, so and as Leigh said, we had over 1,000 respondents from our educators, and we're in the process of analyzing that. What was really exciting is that across from a very cursory idea is as Leigh identified, seeing seeing the similarities across the country and then some nuances as well of what's happening. But we, went into this with an idea. And what we've seen in this very beginning piece is that we've found a place where people are saying we need more in one way or the other. Sometimes they're saying outwardly we know more, and sometimes, like as Leigh identified, avoiding actually identifying the idea of self-care and what well-being looks like for them. But it's really exciting that we can one of the important parts in our research is doing things alongside people and so not doing upon them. And so when it comes to building for educators, we really wanted to make sure that their voice was identified and present. And we knew that the shelter specific educators were such a small niche, but we've been hearing over and over again from educators across the country that the world's different. The world they work in is different. The children are different. They're different. And so, how do we build some of that gap, that bridge to identify that gap? So, I know that we're really excited to be able to continue to this work and being able to share this long term. And so as Leigh identified, our next steps are is over the spring we are doing our data collection. We have a lot of the pieces are rolling, and we can feel it's been a year of getting everything started and everything's coming together quite lovely. So we're excited about that, and we're going to continue to do our tool construction. We have our data collecting over the summer into the fall, and by next spring, we're hoping to have our toolkits, our process evaluated, and then being able, a year from now, being able to share where we're at with this as well, which is really exciting. And so, I mean, from my perspective, we'll throw it back to Anna and Jessica and to Akira, but we're really always open for questions and any curiosities anybody has.
Sorry, I've lost my voice. Thank you so much, Lisa, and thank you so much, Leigh, for that, like, really so comprehensive presentation on two really fascinating research projects, really important research projects. We're such a pleasure for us and a privilege for us here to be able to be here today and to hear from you. I'd like to open the floor now for some questions and comments. I'm not sure if we have any questions in the chat yet, but would anyone like to kick off? I have a question, maybe for both of you. I can start, and I mean it's relating to the community development, the values and principles of community development, which are clearly embedded in your projects. But I'd love to hear more about how you see how they are, how you use that framework. You talked at the beginning about using the AIEB standards, the IACD standards, and work from Scotland as well. So maybe across the two projects, how do you see, or how have you been able to integrate and apply these in a concrete way? Thank you.
It's a great question. I think for us, a lot of what we do is in partnership. A lot of what we do is in collaboration with the community. And I think that having that relationship is one of the key areas. Listening to, working alongside, not trying to be the expert, but help connect some of the dots. Um, when working, I am inspired every day by the leaders in our community that when we have an opportunity to, you know, help affect change, help improve access, equity, inclusion, I get really excited because as educators and as faculty, we're in the classroom a lot. We're working with students, nose in the theory, that I find it's really important to be able to live those values of good community practice. Um, I'm not sure I've overtly discussed the standards within any of our projects because I feel they're so core. They're just part of our, values-based approach. Um, and I think it's showing my privilege in that the people I have the honor of working with in the community and as faculty embody them and know them so well that I haven't had to use it as a teaching or as an overt practice when working in the community. Um, we talk about it a lot in class, and we try to make the connections between good practice, good standards with what we do, and how we do it. But I'm not sure we've overtly done it in terms of explaining it explicitly with any of the practice we've done.
Well, and I would say, Lee, as somebody who's not a community developer from background, right? For me, I'm an early childhood educator. That's my background. I'm in leadership and education and developmental psych. Like, so that's mine. And one of the things that I'm, again, greatly appreciative, and I'm going to embarrass Lee a little bit with this. Um, the rest of us are early childhood educators around the table. That's who we are. And we're lucky to have people who have other pieces that come into play. So we have a very dynamic group around us. But when we were looking for our community development person, and the degree is fairly new, I think we're in our ninth year, we knew that we were looking for a unicorn who understood enough of what we did, but who could come in with a community development background, right? So we called her the unicorn because I'm not, without exaggeration, we interviewed 6 rounds, and because we just couldn't, there wasn't that piece. But what I have been able to learn over the past 6 years, Lee, it's like it's been a while. It's been a while. Is that when early childhood education is done well, it is so, and we knew this in the construction of our degree of having early learning and community development intertwined together, is that children never grow in isolation and they don't grow on their own. And so that bloom around it, again, going back to Bronfenbrenner, looking at where, so everything that happens in the world around that child, there's an impact point. And that's when we have students who join us after they take a 2-year diploma, and they come in with a very early childhood lens. And we're able to push just that piece further and say, so do you recognize when this law over here is happening, how that might impact? Or do you recognize, when we have students do practicums in our food sustainability programs, food banks, and they're like, but I don't see the connection. It's like, give it a week. You're going to see that when you're in those spaces, that community aspect for those children, and for the group around them, it makes a difference. And so what I'm seeing is this beautiful um, opportunity for it to be very flowing back and forth, and watching the work around us change and morph, like the shelter project. 10 years ago, I could never have imagined that. Having educators working shelters at that time, people were like, they're really not trained to be there. You need a social work background. You need to be a child and youth work. And to some degree, I see that, because at that time we were very linear. We were not finding a bit of more of a mutual space. But I feel like, and I mean, and hats off to internationally how you do the community development, because it is game changing in how we've looked at pieces that children need community. We know this, but we weren't doing it as well. We were very, very isolated. So that's what I'm excited to see, is where in our communities are children that are not having access to equitable and equal opportunity. So um, I'm
And I,
excited to continue to learn alongside this, but yeah, it feels just more natural than implicit, right? So explicit, yeah.
one of the unique things about Algonquin and all of the partners that we have that sit around our uh, like we have a community planning table. The acronym's escaping me. It's probably because I'm a little embarrassed after you talked about me, Lisa. But it almost it almost seemed like the program was designed. The Bachelor of Early Learning and Community Development was designed with those 8 core themes in mind, whether it was intentional or not at the time, because the whole like participatory democracy, the whole working towards change, improving access, they're all ingrained in the practice and the program. And I think the partners that we work with, Kim Hiscock and the Andrew Fleck organization, with the other community partners that we work with, much of the work they do embody those practices, whether they're aware of it or not. Those like fundamental key elements of good community development, um, they're there. And I think it would be really interesting to, almost sit down and check off those 8 themes and to look at all of the areas, because like off the top of my head, without having the cheat sheet in front of me, I'm like check mark, check mark, check mark, check mark. But we've never sat down and explicitly like linked to each of them, which now has me like spinning. I'm like, ooh, summer research project.
I think that could be like my suggestion actually was going to be maybe you'd consider writing a paper for the Community Development Journal, which explicitly draws out how the work you're doing exemplifies the principles of community work. I think it could be really interesting and useful
Great
contribution
idea. It,
for other practitioners that are working in those spaces. And
mhm.
it also might support the development of the work as well. So there could be a twofold
Yeah.
opportunity. We have a question in the chat from Francis Nuji, but first, Anna's had her hand up for a while, so I'll invite Anna to come in, and then Francis, I'll read out your question, unless you'd like to read out yourself, which you're very, very welcome to do. You can decide while Anna is speaking. Thank you.
Thank you, Kira, and also to Leigh and sorry, Barbara. It's because there's a B, and Lisa as well. I have to admit, particularly the first part of the work that you were talking about, I found quite powerful and intense. I really appreciated the kind of next level consideration and intentionality that has gone into that work, particularly in terms of the, sort of like exploring what inclusivity means in the context of the diversity of people in all our glory, and putting that at the heart of people and community as well. And there was a lot of warmth, and also I think a lot of courage behind that work, which came across to me anyway. Um, anyway, beside of all of that, yes, lots of questions. I have probably about 8 written down here. I won't ask them all, but in some respects, I suppose my thinking is moving on from Kira's, because that was one of my questions, and particularly, Barbara, when you were talking about the continuum and the scale assessment. And over the years, I've done a lot of work around the development of standards for community development in different geographical contexts across the UK. Sort of been involved with the development of that in Ireland, and the international standards. And a good few years ago, I wrote a guide on how to use community development standards, and have developed a lot of resources over the years with the work I've been doing with organisations and with groups as well. One of which was a self-assessment toolkit on that, using the standards and the extent to which they shaped and informed community development practice. And my question is kind of like, when we ask people to do these pre-assessments, and then we give them the assessment, self-assessment things to do, in our heads, there's a nice logical progression to those. You're going to very clearly come out here. And the theory is, if you are not familiar, you're going to be at one end of that progression spectrum. And then when you go through a process, oh, wonderful, we've all moved nicely along, and reached a point further on. My experience is that it's often anything but nice and neat and moves in that. And I was curious as to whether that had been your experience as well. And did people find, they were sort of like a bit here and a bit there and coming back to things, and actually where they put themselves to begin with in the pre-assessment was way up, and when they did it, they brought themselves back down, even though there had been development that had taken place, and growth and understanding. So that was one of my questions, how neat was your experience of working with people in terms of doing that? The other thing that struck me when you were talking about the bibliotherapy work, and which I'm not familiar with, it's not a term, I think I've heard you use it before, but it's not something I'm familiar with. But it kind of struck me that it reminded me of some of the work of Paulo Freire and his development of codes. And I kind of thought, this is a little bit of a similar way of looking at it. It's about using images and words to help people engage with ideas and themes and experiences, and express and vocalize that. And I suppose that's more of an observation than a question, but I was interested if you had looked and did Freire's work around any of that, help and shape how that's developed. And the bit that I was curious about as well is in terms of that for educators, but also for families and children. Does engagement with all of that, apart from being beneficial for the individual child or the family, actually facilitate people coming together to look at those experiences and sort of go, yeah, this isn't just us, this is more than just us, there are others that are experiencing this, and what does that tell us? And in that sense, is there a development process that brings people together to look at those experiences that might lead to change as well? So I think that's one observation, 2 questions, and a lot of talking. I'm going to stop there.
Thank you, Anna. I appreciate it. Yes, I'll start at the beginning. So the self-assessment to the assessment, it was tricky, um, because all 3 of the partners were very well respected, and we intentionally selected them because we knew they were already high standards. We didn't want it to appear punitive. We didn't want anybody to feel unsafe going through that evaluation process. And They all consented to having their names attached as part of our ethics. They were very willing to. They wrote letters of endorsement. They wanted the accolades to be vulnerable, to go through the process and show their growth. Um, but then when we sat down to talk about it, there was a bit of uncomfortableness because they realized that it was more than all are welcome here, blanket statement, right?
Mm.
Um, our one center did one assessment for the whole center. They had a staff meeting and they did it together, and it was uncomfortable and it was awkward, and there were pauses in conversations. Um, the second center, they had one per room, which meant the toddlers filled out a room, the preschoolers filled out the room, and the infants filled out a room, and they submitted three for us. And then the other project, it was kind of a bit of a free-for-all where we got like 9 or 10 where educators filled it out. And so we had to go back and say like it should be filled out by like not just the center director or a person in the lead, but one response per center because we found that um, people were quick to criticize what their peers weren't doing well, but they had this false sense of self that they were exempt and like better than everybody else, which is human nature, right? Like we all think we're doing a great job. We would never want to think that we were being exclusionary. Um, but it was messy. And we had to go back a few times, AJ, just to say, um, okay, I appreciate this. Can we like go through it? What does it mean? How does it work? Majority of them thought they were doing better than what they actually scored, but because it is self-assessment, I think they still scored themselves a little bit better than maybe what we would have scored them. And that's not to be critical of them, but we had to emphasize it's what the majority of you do the majority of the time if this situation were to arise, because they're quick to think of that, yeah, we did that, and it happened once, but it might not be the typical practice because when we saw what they were wanting to work on, um, it was all items that they had still scored themselves very well, but what they wanted to work on and why they wanted to work on it almost contradicted their self-assessment score. Um, and because we didn't want to share their scores with anybody, it was their own reflective process. We went on developing the training along what they said they wanted training on. Um, and then we asked where we saw that people traditionally scored a bit lower if they would also want those elements included in the training. So we tried to find the balance, but it was a bit messy. Um, and I think too, with any self-assessment, um, you're relying on their self-reporting, right? So
Leigh, can I
yeah, it
add
was
to
a bit
that?
messy.
Can I add to that?
Yes.
Because I remember when you guys were going through that in the conversations we had about the messiness, because it's a great word for it, because it really was complex. I feel like one of the pieces that um, in our pre-service at a very large, so again, even nationally, and I think it's also very North American, is that we come from an expert model. And so it's like educators need to be the expert on things. And so when they're looking at themselves in a way like, well, I truly believe educators come in doing absolutely the best they can with what they have, but this is a space where many of them don't know. And the willingness to say, yes, I want to try, but also I'm not an expert and I don't know and I don't want to offend people. And it's just this tension that's around for many people who are living that every day, going, well, no, this is, you need to be in the messy to be able to be on the other side of it eventually, right? And I have found in the 20 years of being pre-service, we don't respond well as a profession to that messiness very well. And I know that other sectors are like that as well. But what I remember having a few conversations with Leigh and just looking and be like, yeah, this actually aligns with some of the other things we've done also in the sector where when presented, people are eager, have some self-reflective practices already built into our professional understanding and standards, but to actually do it where it becomes a bit more challenging or there's a little bit more vulnerability, it's still very, very difficult. And that's where the self-care piece we're seeing in the other project, where it's like, we can talk about trauma because it's outside of me, that's somebody else. But then if I have to look at me, it's like, I don't know, I'm uncomfortable, and then they pull away from it. So we're seeing some similarness to that. But
I appreciate your comment about Paulo's work too, because yeah, community development and over the years it's always been an inspiration, right? And I think one of the pieces I'm most excited about is taking the links from community development roots with the bibliotherapy and the element coming out in the newest project that we're doing of the children's drawings. So a lot of the work I've done in the past and a lot of the work I have the students do is photo voice. And they do a lot of photo voice work where they're presenting their ideas, connecting theory to practice through photographs, through visual images. And we are currently negotiating that process with our research ethics. The centers are all on board to do it. The moms are all on board to let the children do it. High level, of course, but we want to make sure that we do it in an ethical way. And so taking additional training and additional courses to ensure that the children who have experienced trauma, um, who are in safe environments, are ready to share. And what does that look like in their drawings? Whether it's mark making at a very young age with a few words that they can use to articulate what they're feeling. Or some of the older children in the toddler or preschool age range are able to draw a little bit more detailed and have some stories. And I'm curious to see how it connects back to some of those elements of bibliotherapy. I'm curious to see how it connects back to, the goals of the program. And then the last piece about the family engagement piece with the bibliotherapy, it's awesome because I finish all of my classes with a children's book, even at the post-secondary level. And I eat, live, and breathe children's literature. And I don't just eat, breathe, and live children's literature for children. I find that the messages are so simple and so easy that they can often be revolutionary to the adults reading it. And this vision was shared by Andrew Fleck, who was one of our pilots. So we had the Canada Research Park Family Center. Andrew Fleck Children's Services has a location right downtown Ottawa, and it's actually located right between a shelter and a food bank. So it's in the heart of our city, and then our early learning center as well. Um, and the Andrew Fleck location, they color coordinated their books and put dots on the books with copies of the speaking notes and put the speaking, like the educational notes inside of the books so that families could borrow them and talk about those concepts at home. Um, where we haven't got to yet officially, but it's kind of informally happening, is talking about the books with the broader community, the parents, the educators, the other families. Um, that hasn't happened. We had brainstormed taking on another project this summer, but we're having to step back just because we all have pretty full workloads right now. But we had contemplated Jade branching off to possibly look at doing some community profiles about the diversity within our community in terms of family dynamics and offering even like a top 10 list of diversity, neighborhood diversity children's literature and putting them either into the little public libraries, the books and the scripts into the public libraries or into like lending libraries that people have in the community at the end of their driveways or whatnot. We were looking at pursuing a grant for that, but we had to hit the pause button simply because with five live pieces of the Shelters Project going to be live in the summer, we thought it was a little bit much. Plus, Jade is still working in program as well because Jade is a registered early childhood educator. She's working in program to get the in program experience and working alongside the educators with the children too. So, having another project come on was a bit too premature, but it is definitely in my catalog of like next to dos. Because a side project I do in our community here, I've set up variations of the library, the bibliotherapy component, working with teachers in primary schools and the parent councils in primary schools within my school board that I'm a part of out here. Um, and so we've started doing a learning practice and a sharing circle that way, but it is very informal and very grassroots, and I like it that way. So I'm a little apprehensive to formalize the process, but that's the grassroots community developer in me that I like it to just be organic and not as planful. But yeah, so those were the three. I think I covered them all in it.
You did, yeah. Thank you very much.
Thank you. There's a question from Francis in the chat. Francis, would you like to speak your question yourself?
Yeah, sure. My name is Francis. I'm from Kenya. I'm a community-based community development practitioner based in Kiambu County, where I deal with community-based organization. So I want to take this opportunity to thank the presenter, Madam Leigh Golden, for her rich and thought-provoking presentation. And in the Kenyan context, maybe early childhood development is devolved to the county government, which creates a complex interface between formal policy frameworks and lived community realities. While inclusion is well articulated at the policy level, its operationalization is often mediated by socio-cultural norms, resource constraints, and the agency of community actors. So from my field experience, community-based organization and caregivers frequently act as de facto drivers of inclusion, particularly in navigating sensitive dimensions, maybe such as gender norms, disability, and diverse family structures. So from my own perspective, I find integration of the GBA framework and development bibliotherapy particularly compelling, especially on how it bridges structural analysis with practical tools. So my question already have maybe indicated in the chat. I really wanted to understand from my first question. Now based in Kenya, so in many decentralized and low resource contexts, early learning spaces are heavily influenced by community norms rather than formal systems. So how can your GBA plus and BB therapy approaches be effectively maybe adapted and sustained in such community-led environment, especially where cultural perception of gender and family differ significantly? My second question, I'm interested in how inclusive early learning tools like yours interact with local governance structures. What strategies have you found may be effective in embedding such tools within community system rather than institutional frameworks while still maintaining fidelity to inclusion principles? Maybe my last two, how can your assessment tool be co-owned by these community actors to ensure sustainability beyond pilot phases. Then lastly, are there opportunities to adapt or pilot your inclusive assessment in global South context through maybe partnership with community-based organization? Thank you.
Thanks, Francis. That's awesome. It's great for that you were able to join us today. I've worked a few years ago now, probably almost a decade ago, in Nairobi and in Alwego Marakwet. So I have a little bit of experience with working with Kenyan not-for-profit organizations. It's tricky, right? It's going to be messy. In Canada, working with the GBA plus, it's the government's adopted framework. We modified it, but it has been used. Um, it is based on intersectionality frameworks. So if you're familiar with intersectionality work, it would resonate with some of the work by Kimberly Crenshaw and others who work in anti-oppressive frameworks and practices. The plus part of the GBA plus stands for the intersectionality. So it's a gender-based analysis as a starting point, but then it encompasses all of the other elements. Um, the GBA Plus framework supports our Charter of Rights and Freedoms that we have in Canada. So we do have that higher level legislation that governs and justifies. So it was easy to embrace and adopt from a Canadian perspective. Doesn't mean everybody buys into it, doesn't mean everybody supports it, doesn't mean we have a lot of work to do here. But at least we have that support. And I appreciate that working within different cultural contexts with different cultural perspectives, approaching concepts about gender diversity, it's a bit trickier. Um, I think a good starting point is looking at the concepts of inclusion and adapting the model from a inclusion, a well-being, a hearing multiple voices, respecting diverse perspectives approach, and almost scaffolding it from there, starting at the beginning concepts and building up of what that looks like with respect to different domains. Um, as a very big feminist and advocate of human rights and social justice, it's very hard for me to start with the baby steps because I want to go all in. But it's often an easy way for us to start the conversation about those dimensions. Um, the tool and the GBA plus spectrum for unaware, aware. Um, I have worked in international contexts where we talk about that inclusion, that accessibility from a aware, responsive, and transformational process where we have all of the elements of diversity, not just gender, that it's framed more from an intersectional approach. And it has been a good place to start those conversations with partners um, who maybe are all starting at a different space in terms of what is appropriate, especially if community members are guiding what is being taught and led in schools. It might be a starting point to establish those best practices with the community members and help them inform. Whereas our research team broke down what that would look like in an ideal situation, it might be a place to start the conversations with the community members and partners brainstorming what those examples would look like. Um, in terms of bibliotherapy, from a developmental bibliotherapy practice, the bibliotherapy is done to help talk about some of those concepts. So, starting with talking about the concepts of inclusion and diversity and welcoming environments, and talking about um, processing identity, it can be done at any age group. So, developmental bibliotherapy we've done from a pediatric perspective for these projects, but some of the developmental bibliotherapy work that I do can be done with parents or even adults in the community. And I know that book club is often one of the examples I give, right? If we're talking about um, Indigenous practices, Indigenous ways of knowing, being, and doing, we have educators here that will select a book, Braiding Sweetgrass. Liz, I'm looking at you. And they will use that book as the kind of common thing that binds to work through those big concepts and unpack those big concepts. And I find that bibliotherapy is often something that we've been doing without being aware that we're fully doing it in a community development practice for years. It's just we didn't know what it was called or we didn't have the same label for it. And I find that it's a way that, survivors of domestic violence, whether it's, single parents, people going through grief, learning about a new topic, it's a great way to come together. And I feel that preparing even a compendium of a few titles to discuss a topic that are age appropriate is a great way to start. It gives us common language to unpack some of the issues as well. So I'll stop there. But Francis, if you want to connect offline, I want to be mindful of everybody's time. I can share my connections through the chat, and I would love to chat with you more if I can help in any way.
Thank you so much, Barbara. It's a wonderful answer. There's so many opportunities, I think, to learn from what you have talked about today, both of you, and also to apply it in our own context and our own practices. And Anna has kindly shared an example from Northern Ireland, which you also might like to explore more and also learn from. So you said it, conscious of time, and we're all in different parts of the world. So we'll draw the session to a close, and we'll thank Barbara and Lisa so much for their time this afternoon, for your insight and as Anna said, the care with which you have done the work and then presented it to us. It really has been a privilege. Thank you so much.
Yeah.
Our next Global Community Development Researchers Forum will be in June. We'll be sending out information in the usual way, so please do come back and join us. And Anna has shared all of the various ways in which you can connect with the IACD by becoming a member, by coming to other sessions that are held frequently, and also by connecting into the website and to Practice Insights, which is a really wonderful resource for exploring the community development practice across the world. I'll leave the last word to Anna.
Thank you. Probably just reiterate the appreciation to both of you for a really insightful researchers forum today, and it has kind of really prompted so many ideas and thoughts and lots of questions. So it'll be interesting to invite you back to hear more, perhaps in a year or so's time, just see where things are at. But I think you made a really good point, Barbara, about a lot of the time we can wait until the very final, kind of like we've crossed every T and we've dotted every I and it's all finished and we've done the evaluations and we can put it out there now, and that's the point at which it's interesting, but actually it's the experience of this work that's really valuable, and the opportunity for people to engage with it in real time. And that means sometimes you haven't got the answers to the questions, or you're still working through something, but that's what makes it vibrant. So thank you for putting yourselves out there and being willing to do that. Really appreciate it. And yes, tapping away furiously with lots of links in the chat. We do have a survey out, an engagement survey that we are inviting not just our members, but anyone involved in community development in any way, anywhere, to take part in. So please do click on the link, and also we would welcome your feedback from today's session just by way of evaluation, and look forward to seeing you at a future event, if not in person in Glasgow, certainly online. Thank you very much.